Outgoing director for the Centers for Disease Control and Prevention, Rochelle Walensky, faced one final grilling in Congress yesterday. Lawmakers in the House Select Subcommittee on the Coronavirus Pandemic pressed her about the COVID-19 policies implemented in response to the pandemic by the CDC. And though the hearing was mostly cordial, Republican members expressed concern over the influence the American Federation of Teachers had over the CDC's guidance regarding schools and reopenings and closings. Let's watch a little bit of that.
Did the American Federation of Teachers provide suggested edits to the CDC's February 2021 school opening guidance, including a trigger to automatically close schools that, if implemented, would have kept more schools closed and kids out of the classroom?
The AFT was interested in having closure triggers. That is my understanding, yes.
So your answer is yes?
Yes, but they were not accepted, of course.
GOP panel members also challenged Walensky on the efficacy of the COVID vaccine. Here's some of that exchange.
The vaccine did not stop spread or infection. I'm not saying it was completely bad, but it did not stop the spread or infection.
I think, actually, if I could actually just correct that point, and that is initially it did. For the Wuhan strain and for the Alpha strain, all of the early data and the literature published in the New England Journal demonstrated that for those who worked, if you didn't get infected, that you were not transmitting it to other people, and it had very high efficacy early on, up to 96%. So
and
it did change over time.
All right, so what do you make of that?
So the first part was interesting. She kind of throws the teachers' unions under the bus a little bit there. I mean, points for honesty. She said, yeah, they pushed for that policy and we didn't think it was a good idea and we said no. A policy to have automatic reasons for schools to close. There had been previous reporting in the New York Post and other places about the really direct attempts by Randy Weingarten, teachers union leaders, other people in that organization trying to, having a lot of contact with Rochelle Walensky to get her to say, because in the pandemic, it was what the CDC says goes, to get her to sign off on kind of the even more restrictive policies that the teachers unions wanted. I remember seeing some teachers union leader texted her and said, hey, we'd love to have a conversation about this. And she responds, who is this? Like, she didn't have the number in her phone. Like, oh, I'm sorry, this is the teachers unions. This is what we want. So interesting. And then, of course, they have the exchange on vaccines that is, and her clarifying that, yes, at first it looked like they were very, in fact, protective of spread as well as severe disease and death, which was the case. But there was a closing off of conversations that was occurring around that point on, acting as if that was always going to be the case. The presumption that the health officials led people to believe was that that was going to be an enduring fact of the vaccines.
I think that was the belief.
Yeah. But it was what I'm saying is it was a belief, not a proven scientific fact.
Right, but the posture of it is we have a vaccine that is doing that. We have no reason to believe it will stop doing that. So of course we're gonna plan along those lines. And when evidence to the contrary comes in, we have to then pivot. And the critique is they didn't pivot fast enough. That's a legitimate critique. But I don't know that the presumption should have been the thing that's working is going to stop working, and therefore we should keep designing policy under the presumption that that it's going to radically change all of a sudden with a new strain. We talk a lot on this show about the things that the CDC got wrong. It is interesting sometimes for me to reflect on how there was a time when the vaccines were working as expected, and there was a lot of people who were wrong about and who were protesting the vaccines at that time and the efficacy of the vaccines at that time. That does get memory hold as well. That there was a push and pull, a give and take about why there became so much distrust, because there were a lot of people who were denying the benefits of vaccination, even when the benefits were more strong and more clear than they are now. Now, of course, the benefits are that they prevent hospitalization and death overwhelmingly. But before, they did have these broader effects on spread, et cetera. So, it's worth making that point. With respect to the teachers union stuff, if you can characterize it as throwing them under the bus, it doesn't really matter. But it does also seem to me that the teachers unions have an interest, and it's protecting the well-being of teachers. As we discussed, there was a recent study that came out a week or two ago that showed that children were a significant vector of the virus, including during lockdowns, and were really undermining much of the lockdown policy. Teachers obviously being vulnerable. Kids aren't dying and stuff from COVID, but adults definitely were. And so in the time before the vaccines, I think there was a very good reason for a teachers union to want to protect the health and safety of teachers by lobbying the government to have policies that benefited them. The problem is, that the government has to look at the interests of a broader group than just the teachers, and it sounds like they did the right thing in this case and said, well, I respect your interests. They're also the interests of students, learning loss, other things, and they made the right call. So this does seem to be another one of those cases where there's just more nuance involved. Mm-hmm. Everybody who worked for the government wasn't a bad actor. There's a combination of changing scientific reality, lagging response to that changing scientific reality, some people who were bad faith actors, some people who were good faith actors but are advocating on the behalf of a narrow constituency. And there's a lot to be learned from this situation, but it's just not the black and white story that people on both sides of this thing are often telling.
Right. My criticism would be, but that policy was made, and it became, and in many places was mandatory based on what the CDC was saying. Mm-hmm. So if the CDC had been more responsible and was more carefully said, here's what we think, mm-hmm. but this is our confidence level is not ironclad. This is just what we think. And also, they were very slow to recognize that if you'd been infected with COVID, that was going to be about as protective, at various stages as getting a shot of the vaccine.
Were they slow? So if they're slow to realize that, that's less of an issue than if they did realize it but slow to admit it. That's the problem.
Right. The problem is, but there were other people, who were described as like heretics or alternate, who were saying these things, who said in the long run they're not going to be, the vaccines are not going to prevent the spread, and that natural immunity is going to be very protective. There were people who thought that and ended up being right. They were just kind of outside the mainstream scientific consensus for a while, and now they're part of them. Now those claims count. Sure. It's just like
I think that's all fair, but
that's what I wonder about.
Sometimes we talk about this as though there weren't vaccines for the first year of COVID. Mm-hmm. So we talk about COVID like immediately we're off to the races and all this vaccine. We were doing policy because for a year there were no vaccines. I think I got vaccinated in like April of 2021.
Me too.
So over a year of COVID before there were vaccines, and people who were healthy were being hospitalized and dying as a consequence. So I do think it's also just important to note the timestamp on some of these things. If I say, well, people were saying that this was a problem and therefore that we shouldn't shut down schools because there was herd immunity and da-da-da-da. Oh, okay, well, are we talking about September 2001?
In some places we were still having a school reopening conversation.
Yeah, if
many months
we're talking
after
September
that.
2001, that's a very legitimate concern. We're talking September 2000.
Yeah,
that was a tougher.
2020 versus 2020.
Sorry, 2020, September 2020. Yes, I'm an old head.
Yeah,
that's
it's September 2000. They were still recovering from Y2K, so they couldn't have schools.
We had different concerns. Yeah.
There's another clip we wanted to play here. Let's get to that. So later in the hearing, Walensky was asked about social media's role in censoring other information about COVID-19 policies. Let's play it.
Did the CDC work with Meta, or I like to call it Facebook still, to censor or otherwise alter any post?
Here's what I can tell you. The most important thing that has gotten us out of this pandemic, I think, is our vaccine and how well they work and how safe they are.
I understand that.
And it was really important that the American people understand how well they worked and how safe they are.
I understand it.
But in terms of the communications, that is, again, something that I'm not going to speak to because it is currently under
court. So you're not going to answer the question?
It is currently under court litigation.
Yeah, so she refused to comment multiple times on communications, which is a shame because that's why I'm really interested in this. She wouldn't comment on how the CDC messaged to social media companies because, and that might sound like it's just an excuse, but yes, there is litigation ongoing. The lawsuit brought by the state of Missouri and Arkansas, I believe, related to social media companies banning accounts like Jay Bhattacharya and others. So she's a part of that, so she can't comment on it, which is a shame because I would like to hear more from her on what she thinks about those policies. I did a really big magazine cover story for Reason, where I also work, on the constant messaging between the CDC and Facebook on all sorts of subjects that at some point, Facebook was basically outsourcing its moderation to CDC. They were, whatever the CDC said, that was then going to be the policy, and that impacted. For a long time, you couldn't talk about lab leak on Facebook. Like, they would delete those posts. There was some, I think they were way too heavy-handed when it came to claims about vaccines for kids and how necessary they might be. And look, I'm sure there are plenty of crazy claims too that maybe should have been taken down, and Facebook would have taken down,
or at least maybe just
even without CDC's input. But they really defaulted to what that agency was saying, and I don't think our federal agencies in general have properly reckoned with whether it's proper for them to have this level of cooperation, coordination, and they're doing this at the same time that's behind the scenes. Then center stage, Joe Biden and others are saying social media companies are killing people because they're not doing more to censor and moderate. And political figures on Capitol Hill are looking at their liability levels and their regulations and saying, how can we make these companies suffer? How can we impact their bottom line? Altogether, that looks to me like a very worrying kind of recipe for
and Mark Zuckerberg
disaster.
Recently, we talked about earlier this week, said he has regrets about what happened there. And it's no wonder, given the amount of pressure that all of these social media companies were under and continue to be under.
And Dorsey said on Breaking Points that it was more vast than he even was aware of. Jack Dorsey, former CEO of Twitter, the Twitter files has taught him that there was way more interaction between government and his own company.
Yeah,
than
and
he
that
knew
it's
about.
ongoing as well, and that he has concerns about not just the Twitter's ongoing choice to perhaps not be as transparent as he would like here in the United States, but also bending the knee to certain authoritarian governments in a way that even he, Jack Dorsey, when he was CEO, declined to do.
More Rising right after this.